All right. My name's Ashley. I'm a occupational therapy doctorate candidate. I'm at the Austin, Texas campus, and I graduate in April, so I'm near the end. Right now, I am working on my capstone experience at the Alzheimer's Association, and my role at the chapter at the Capital Texas chapter is as a community educator right now, which means I get the opportunity to do a presentation like this for community stakeholders and help public awareness or raise awareness for information about Alzheimer's and related dementias. But Alzheimer's and related dementias isn't a very roll off the tongue name, so it is Alzheimer's Association. Yeah, so as I said, I'm at the Capital Texas chapter, and my connection to the disease is that I used to work as the weekend activities coordinator for memory care unit back in Georgia, and I did that for a year and a half, and that gave me the opportunity to private sit for one of my families that I was really close with in the unit, and I worked for an older adult with dementia for about 2 years. So Alzheimer's is something near and dear to my heart. But today we're going to be talking about the warning signs of Alzheimer's and other dementias, and specifically for those who have noticed memory or thinking changes in themselves or others. This program was created by the Alzheimer's Association, and so you'll kind of see throughout their branding. Yeah. I also wanted to let y'all know that I want to be respectful of everyone's time. So if you could please write down your questions as we go along, and I'll make sure to have 5 to 10 minutes at the end to answer any questions you have. All right, we'll go ahead and get rolling then. Also, pause. I'm going to be showing a few videos today. So if you have trouble hearing them or me, please come off of mute because I can't see the chat that well, and just shout at me and I'll try and troubleshoot it. All right, without further ado. Okay. So I'm going to go through the learning objectives first. If you're like me, I won't read these unless they're read to me. So we'll go ahead and get this started. So today, I also want to kind of let you know that I want to focus a little bit more on the 10 warning signs and compare those to age-related memory, thinking, and behavior changes. I also want to discuss how to have a conversation about these memory concerns if you are noticing them. I want to spend a little bit more time on early detection and why it's so important to get a diagnosis. And then lastly, I'll wrap up with possible tests and assessments that are available for diagnosis, as well as the resources that the Alzheimer's Association offers. All right. So throughout this presentation today, we'll have a fictitious family called the Garcias that will kind of follow along and see how their mother's memory changes will occur and kind of take action to find the cause. So please note that experience might be common, but it doesn't represent the exact experience for everyone, as situations can vary from person to person. Or as I like to say, if you've seen one case of Alzheimer's, you've seen one case of Alzheimer's. Okay. So first we have Mary. She's a 73-year-old widow who lives alone. She's a retired teacher and has always meticulously cared for her home. Her daughter has recently noticed laundry piling up and mail and newspapers scattered around the house. This is Lydia. She's the eldest of Mary's 2 daughters, and she lives a few miles away, so she's able to visit her mother frequently. Whereas Patricia, over here, lives in another state, works long hours, and that prevents her from seeing her mother often. So she communicates with her mom and her sister a lot over phone and text. So Lydia, the one that lives close by, is concerned about her mom's noticeable lack of tidiness and that she's continuing to lose things. So she decides to reach out to Patricia. Okay, so Lydia's worried about mom. She's losing things and the house is a little bit messier than it normally is. Patricia is saying, isn't that just normal aging? And so Lydia's just a little worried. And so they're going to reach out to their old neighbor, Dr. Salloway. And even though this is a fictional scenario, Dr. Salloway is in fact an actual MD, and he is a leading expert in aging, Alzheimer's disease, and other memory disorders. So let's see what he has to say.
As we get older, cognitive problems become more noticeable for almost everybody. and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
So he kind of gave us a little prequel to what the 10 warning signs are. So we'll go ahead and dive in. I want to first take a moment though, and I'll move this over so you can see. So I first want to discuss what the terms dementia versus Alzheimer's mean, just because I know they're used very interchangeably, but there's actually really big differences between the two. So let's go ahead and hear about what dementia is.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
Okay. So as she said, dementia is that really broad term for it. I kind of think of it like the word soup, and there's like a bunch of different soups. So as she said, Alzheimer's is the most common one. It accounts for like 60 to 80% of cases. So let's go ahead and talk a little bit more about what exactly Alzheimer's is.
More than 100 years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles. Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. Alzheimer's disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's, such as memory loss, behavioral issues, problems with thinking, planning, and at the end stage, swallowing.
Okay. So now that we know a little bit about how there's changes happening with dementia or Alzheimer's specifically, the Alzheimer's Association made a list of 10 warning signs to help people understand the difference between normal aging and common signs of possible dementia. So this list is actually a tool, and it does not constitute a diagnosis. It's really important to note that. And it's just simply the most common examples of the experience. Individuals may experience one or more of these signs in different degrees. But let's go ahead and dive in and explore each sign and contrast it to what typical age-related changes may be. Okay, and that is getting cut off more than I'd like it to. So I'm going to move that over. Okay, so the first warning sign is memory loss that disrupts daily life. This is one of the most common signs of Alzheimer's, especially early on, is forgetting recently learned information. Others include forgetting important dates or events, repeatedly asking the same questions, and increasingly relying on memory aids or leaning on others for tasks that once were handled on their own. This is in contrast to a typical age-related change, which is sometimes forgetting information, but remembering later on, like when you walk into a room and you forget why you're there. I know I've done that. Okay. The second warning sign is challenges in planning or solving problems. Some people may experience new difficulties in executive functioning, which includes developing or following a plan, or even difficulty concentrating. Conversely, a more typical age-related change is making occasional errors when managing bills or household finances. So we're going to hear a little bit from John, who's living with dementia with Lewy bodies, about how he experienced this specific warning sign.
I was probably spending 4 to 5 times more time preparing for something than I did, say, 5 or 10 years ago, because of I would lose my thought, I'd lose my focus, I'd get anxious, I wouldn't get to sleep. I was thinking, I was in my sleep, I was thinking about what I was anxious about, which was I was trying to remember, which was I was trying to prepare, which I was trying to do. So it was really a vicious circle so I was able to control it a lot, so that people wouldn't see things, and there weren't things to be seen. It's what was disturbing me was what effort I had to put into to do the things I used to do more easily.
All right. The third warning sign is difficulty completing familiar tasks. So people living with dementia often find it hard to complete daily tasks that they used to manage with ease, such as driving to a familiar place, writing a grocery list, or remembering how to play a favorite game. Conversely, a typical age-related change would also kind of be more of needing help to use a microwave or a remote, or having trouble with new technology that the person hasn't had the opportunity to engage with as frequently. So let's hear a little bit more about this warning sign from one of the dementia care experts at the Alzheimer's Association.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
I think it's really important how she mentioned kind of this, what's normal for the person. And we'll kind of get a little bit more into that in a few slides. We'll go ahead and move on to the fourth warning sign, which is confusion with time or place. So an individual with Alzheimer's or another dementia may lose track of dates, seasons, or the passage of time. This may cause trouble understanding something if it's not currently happening, or become confused about where they are or how they got there. This can be a little bit more dramatic or profound, specifically for those in the middle to late stages. And this is in contrast to a more typical age-related change, which could be getting confused about what day it is or when a scheduled appointment is, but figuring it out later. And that's the key there, is always being able to come back and remember it. Next, we have trouble understanding visual images and spatial relationships. So some individuals with Alzheimer's or another dementia may experience vision problems, which can lead to difficulties with balance, trouble reading, and problems judging distance and determining color and contrast, which you can imagine can impact things like driving or navigating the environment around them. So vision changes like cataracts, that's more of a typical age-related change. So it's really important to notice that changes are not just about memory with Alzheimer's and other dementia. It's important to think about all the other ways that somebody's daily life may be impacted by any of these changes. And I think our expert does a great job explaining this, so I'll have her throw her tidbits in real quick.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing, and in fact their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
Really important. One of the things I've noticed working in the memory care facility was a few of my older adults with dementia would have this thing called tunnel vision, where they're not able to see anything but other kind of like out of binoculars. So it's important to note again that this Alzheimer's and other dementias can affect things other than just your memory, is the key takeaway I want you to understand here. Okay. The sixth warning sign is new problems with words and speaking or writing. So individuals may have trouble following or joining a conversation. stop in the middle of the conversation and forget what they were talking about, and or continuously repeat themselves. They might struggle to find the right words or call things by the wrong name. They might also start using more descriptive terms to talk about something rather than the name of the actual item, like, for example, calling a watch a wrist clock, or something like that. This is in contrast to a normal age-related change, which would be occasionally having trouble finding the right word. So we're going to hear from Phil. He is living with Alzheimer's, about how he experienced this warning sign.
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
So Phil really helps drive home that message of, the normal for him was he was a reporter, a writer. He was really good with words, and struggling with words. You can see how that's a very cause for concern for him based off of that normal or prior level of functioning is what we say. The seventh warning sign is misplacing things and losing the ability to retrace steps. I don't know if you're like me, but I lose my keys or my glasses from time to time, but I'm always able to retrace my steps where I found them. Oh, I was doing my hair. Let me go check in the bathroom, things like that. Whereas with Alzheimer's and related dementia, it'll be misplacing things from time to time and not being able to retrace them. So they'll lose things and not be able to recall where it was last seen or kind of know where it might have been placed. And they'll put things in unusual places sometimes, such as putting shoes in the refrigerator. This is because of the lack of executive functioning and awareness. So that person may grow increasingly suspicious of others and actually start accusing others of stealing and do so more often over time. So we're going to hear from Ruth Drew again about this sign.
So some people wonder if, if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And one thing that I would say about that is for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in and they set their keys down in an unusual space, so there they are next to the phone. If that happened to you or me, we'd probably remember, oh yeah, the phone was ringing when I came in the door. I put down my keys. The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things in Alzheimer's.
I think she does a great job summing that up. So we'll go ahead and move on to the next warning sign, which is decreased or poor judgment. So individuals may experience changes in judgment or decision-making, such as using poor judgment when dealing with money or paying less attention to hygiene and grooming. This can be really common in individuals who live alone. And it's important to understand that making a bad decision once in a while, such as forgetting to get an oil change, is a more typical age-related change. I think Teresa has really great insight on how this specifically affected her. So let's go ahead and hear what she has to say.
The way I kept my house, I wouldn't say I was OCD, but pretty close to it. And all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually looked like it was someone's office, because I always would say I would do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet wreck, but really I was, because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
So again, reinforcing that what was normal for her before and kind of comparing that, oh, she used to be very clean, keep everything very tidy, and now there's kind of a change, is kind of that signal of something's going on. The ninth warning sign is withdrawal from work or social activities. So as we age, it's pretty normal to feel uninterested by family or social engagements at times. Been there. However, somebody who's experiencing dementia-related changes may actually start to lose their ability to hold or follow a conversation, and as a result, begin to withdraw from social encounters and hobbies. They may lose the confidence to engage in that way because of it too. So we'll hear from Dr. Salloway about what he has to say about this warning sign.
One of the most common changes and early on is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable with that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. That's can be one of the early signs of Alzheimer's.
And more in that early stage. And the last warning sign is changes in mood and personality. So people with Alzheimer's or another dementia may become confused, suspicious, depressed, fearful, or anxious. They might get easily upset either at home or when they're out of that comfort zone, as Dr. Salloway was kind of talking about. As we age, this is in contrast to normal aging, where it's normal to develop specific ways of doing things and becoming upset or irritable when your routine is disrupted. However, what makes it a little bit different for those with Alzheimer's or another dementia, they may respond in a way where they become fearful, angry, easily frustrated, which is something that should be addressed. And we'll actually hear from Dr. Salloway one more time to hear about his thoughts on this sign.
Another early sign of Alzheimer's or dementia is subtle changes in behavior. So all of a sudden, the family may notice the person is more easily irritated, or more impatient, or a little moody, or have a shorter fuse, or more anxious. Now, there's lots of things that can cause that, but often that can be an early symptom of Alzheimer's or go along with the early symptoms of memory loss.
Go ahead. And we're going to go back to the Garcia family that we were talking about earlier. So go to this text chat with them. So Lydia is asking if her sister had looked at the warning signs. Patricia is saying that she wasn't sure. Her mom showed signs, but she's not sure if it's serious enough to see a doctor yet. So let's see what Dr. Salloway says about when is it cause for concern to bring this up to your doctor.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people. But they don't have to check off all the boxes.
So Dr. Salloway gives us a great recap of all that information. I want you to kind of take away from this 3 things. These warning signs are intended to be a guide to kind of help identify problems in memory, thinking, or behavior that may be related to Alzheimer's or another dementia. As he said, the individuals can experience one, all, or some of all these signs in various degrees and in numerous or single occurrences. They don't have to experience them all for there to be a concern. And lastly, it's important to discuss any changes in memory, thinking, or behavior in either yourself or someone else with your doctor. So now we're going to move on to early detection, which is something I think is very important, and get into that. So it's key that we pay attention to what's going on with our cognitive health and that we don't dismiss any changes as normal aging. Any change that's unusual for your level of functioning or that of someone around you is cause for concern. And many times I really like this slide because it emphasizes how family and friends are often the first people to notice changes in someone's memory, behavior, or other abilities. And that's helpful because sometimes the person exhibiting symptoms isn't aware, or they may not have insight to know that they're experiencing these changes, which is why having that outsider perspective is really critical. And it's really important for individuals who live alone or are far from their family or friends to kind of have the support system to kind of recognize these changes too. So we're going to listen to Dr. Salloway again, and then we'll hear from a care partner about what she kind of noticed in her husband.
You know, it's a very interesting phenomena that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, paying attention. If they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
Really important there. So we'll hear about this firsthand experience from Mary, who is noticed the warning signs in her husband.
I was so adamant about what was happening to Daryl. I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. My husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
So again, that normal, or what used to be that normal level of function, is changing, and that's kind of how she noticed something was off. So what should you do if you notice these changes? Well, the most important thing I want you to take away from this is to address it sooner rather than later. So many times people want to put it off because the conversation's hard to have, and I totally understand that. But it is so important to have this conversation sooner rather than later, which I will explain in the coming slides. But just so you can mainly have a plan to take the next step. So this can definitely be a difficult or uncomfortable conversation to have. So the Alzheimer's Association developed this little roadmap of 10 helpful steps to make addressing these concerns a little bit more productive. For time's sake, I'm going to go through these a little bit quicker because I want to have a little bit more time to talk about the benefits of early detection. So first, I will start with assessing the situation. So this will be looking at what is the person doing or not doing that's really causing concern. Next, I want you to consider other things that might be going on, because various conditions can cause changes in memory, thinking, or behavior, such as stress, diabetes, depression, change in medication. It's important to think about other health and lifestyle issues that could possibly be contributing to these changes that you're noticing. Next is learning about the signs, which you're doing by being here, and the benefit of early diagnosis, which we'll get into in just a few slides. And then, has anybody else noticed the changes you observe? This is why it's so important to talk to family and friends and see if they have noticed any changes as well. All right, the tough part, preparing to have that conversation. So this is really important because you should think about who should be the one to bring up these concerns with the person, whether that be you, a trusted family member or friend, or a combination. So again, just kind of touching on who should have that. So I also want to point out it's usually best to speak one-on-one to the person so that they don't feel threatened or ambushed, but use what you know about the person to judge what approach might work best. Also, it's important to consider when and where the conversation should be held. Again, important to have this conversation as soon as possible so you can identify a date and time, and also consider where the person would feel most comfortable to kind of have this discussion will be helpful as well. Okay. What will you or the person having the conversation say? Great question. There's a few different formats that they kind of talk about in the program, but the one that I think is the most productive is very objective statements like using I statements. I noticed, example, you're repeating yourself a lot and it's worrying me. Has anything else like that happened? So when you take it from a place of concern and focus on using those I statements, they're a little bit more productive. This one is another important takeaway I want you to take away from this is to offer to go to the doctor with that person and try and use encouraging words such as, I think it would both give us peace of mind if we went and talked to a doctor, or there could be a lot of things causing this. Let's see if the doctor can help figure out what's going on. Having more encouraging words and not trying to focus on this is what I think it is or arriving to a conclusion, and being more of a support in this kind of process. And if it's needed, you might need to have 2, 3, 4 conversations. Going back to the time and place, maybe the first conversation was later at night, and you can try next time in the morning, see if that's a little bit more productive, or, try switching the different places where you're doing it and kind of consider those factors. So it's important to not be discouraged if that first conversation isn't as successful as you hoped. And you can write down notes about how it went, what you think went well, what you think didn't go well, to help prepare with a future conversation. Do not dismiss these changes you're noticing simply because the person is reluctant to address them or the conversation didn't go as planned. Next, reach out for support. Great place you can reach out for support is the Alzheimer's Association, and I will tell you a little bit about some of the services we offer in the coming slides. But again, see that doctor, ask if you can accompany your loved one, and be there for that process. And I also want to point out that most people address concerns about memory, thinking, and behavior with their primary care physician first. However, in some cases, your primary care physician or PCP may refer to the person as specialist for further evaluation. Some examples of these include geriatricians, who have additional training and medical care for diseases and conditions common among older adults over age 65, neurologists who specialize in diseases of the brain and nervous system, but not all neurologists specialize in Alzheimer's and other dementias, so it's important to know who your provider is and what they specialize in. There's neuropsychologists who can assess, diagnose, and treat psychological disorders associated with brain-based conditions, psychiatrists who specialize in disorders that affect mood or the way the mind works, and lastly, psychologists who have specialized training in testing memory and other mental functions. So just a few that you might hear around town. All right, so now that we know what to look for and kind of how to approach that conversation, we need to have the conversation of why is it important to have early detection, or why is it so important to, go and get that addressed? Well,
there are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
So just to recap, there are numerous benefits to early detection, such as planning for the future, access to treatment options, and even participation in clinical studies. The reason that I think early detection is so important is because it could possibly be something other than Alzheimer's and dementia. And it's so important to, get ahead of that problem and kind of work proactively instead of being reactive to it's too far down the road. What can we do to address this? It's always important. Again, that's why I stress having that conversations as soon as possible. So we'll move on. So now we'll take a look at what may be involved in determining the cause of the symptoms that you're concerned about. But first, we will have a little quiz. So if you're feeling brave, go ahead and come off of mute and tell me what you think. True or false? There is currently no way to diagnose Alzheimer's disease.
False.
False is correct. So I'm glad that the outdated belief is kind of dissipating amongst the general public. Used to be believed that only the diagnosis could be made at autopsy, but in fact, there's actually a number of assessments and tests that make it possible for healthcare professionals to diagnose Alzheimer's and other dementia with a high degree of certainty. However, determining the cause of dementia is what can be a little bit more difficult. Okay, so we're going to explore a little bit more about the diagnostic process. So every doctor is different, so it may look different, but typically the assessments that might be include the medical history, a physical exam, a screen for depression. That's going back to, hey, maybe it's something else than Alzheimer's and dementia, an interview with the close companions, whereas the tests may include laboratory tests, mental cognitive status tests, brain imaging like MRIs, CTs, or PET scans, and cerebral spinal fluid analysis. But it really just depends on your doctor's preferences. Okay, so we're going to bring it back to the Garcias and apply kind of the daughters are wondering, do dementia-like symptoms always result in a diagnosis of Alzheimer's or another dementia? So let's go and see what they're talking about. Okay, so appointments are going well. Mom's handling them okay. Patricia says, I think it's really dementia. Lydia says, I guess we won't know until we get a diagnosis, but let's ask Dr. Salloway if it could possibly be anything else.
Someone could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
All right, so we're going to recap kind of what he said. So the diagnostic process is going to vary from person to person, depending on the individual's specific situation and what the doctor feels is the right course of action. The diagnosis may be something other than Alzheimer's or another dementia, which is why it's so important to investigate the cause of the symptoms. Stigma and misconceptions about Alzheimer's, like nothing can be done, can deter some people from seeking a diagnosis. And lastly, getting information and support is a critical next step. So let's learn a little bit more about what support services like the Alzheimer's Association offers. Right after you hear that diagnosis, what's next? Let's get into it. All right. So what's next when the diagnosis is Alzheimer's? We'll see what Mary's daughter, Lydia, and Patricia do. Okay, so Patricia says, Lydia said, I called but got your voicemail. How'd it go? Lydia says, call you later, but when I get home, but the diagnosis is early stage Alzheimer's. Patricia says, oh no, what do we do now? Lydia says, doc says the Alzheimer's Association offers free resources. Some even help people live well with the disease. We'll call soon, but left the office with some hope. All right, so now we're going to talk a little bit about the Alzheimer's Association, shameless promo. Okay, so as you can see in that video, it's an organization that is nationwide. Their mission statement is to kind of accelerate global research, drive risk reduction and early detection, and maximize quality care and support. The vision of the Alzheimer's Association is a world without Alzheimer's and other dementia. So now we'll talk a little bit about the services that they offer. All right, so the 3 key resources that I want to promote are the helpline. This helpline is 24/7. It gives you access to highly trained and knowledgeable staff who can help you with education, decision-making support, crisis assistance, and resource identification. This service is free of charge, and it's offered to families at any stage in the disease. And it's important, I wanted to note that this is available in more than 200 languages, which is great, especially being in Texas and having Hispanic or Spanish speakers. Next is the online website, alz.org, which is often the first stop that people go to following the diagnosis. So there's sections on the website. If you want my advice, it's a lot of content, and there's a search bar in the top right corner. And if you ever are looking for something, say, I want to know stuff about people living with the disease, you could type that in the search bar, and that'll be a little bit easier to kind of navigate than trying to find it through the website, in my experience. And lastly, the Alzheimer's Association and AARP came together and created this resource, the Community Resource Finder. It has a bunch of community-based resources available in your area, such as long-term care, community-based services, local Alzheimer's Association offices, and programs and support in your local community. So you basically just go in, you'll type in your zip code, and then it will give you options of different services near you. And then, now that we've talked a little bit about the resources available, we can talk about how you can take action. So I will briefly go through these. So you can volunteer. There's opportunities to be a community educator, like what I'm doing right now, where you deliver presentations to the public to promote awareness for Alzheimer's and other dementia. Or you could do something such as joining your local walk committee. To learn more about this, you can go to alz.org/volunteer. If you are interested in advocacy, the Alzheimer's Association has an organization called AIM, and they speak out on behalf of the rights and needs of those facing Alzheimer's disease. You can find more on that at alzimpact.org. I believe they have a march at Capitol Hill in Washington in the spring coming up. Trial Match, which I think is an amazing service that I wish got more spotlight. It helps get people matched up with clinical studies, and it's free of cost. So I like it for that reason, and this gives you access to treatments that you otherwise wouldn't be able to kind of try out. So it's a great resource to explore for sure. As I previously mentioned in the volunteer slide, the Walk to End Alzheimer's is a nationwide fundraiser, and it's to help with Alzheimer's care, support, and research. If you're interested in this, you can find more information at alz.org/walk. And lastly, this is a new initiative called The Longest Day. It's for the summer solstice to raise funds and awareness for care, support, and research of Alzheimer's Association through an activity of choice. I think I saw the other day, there's one person who did pickleball last year. I thought that was pretty fun. And you can find more information on this at alz.org/thelongestday. All right, now that I went through everything, I'll go ahead and pause for questions. I'm also going to pull up the sign-in sheet. If you missed it at the beginning, please sign in if you can. It just helps us make sure that these programs the Alzheimer's Association offers are free. Thank you for your time, guys.